Brad Paisley. She's everything here on 94.1 BYS. This is the Morning Mojo Show. I'm David Cottrell, and happy to have with us back in studio Nicole Robertson with the American Cancer Society, and we're talking about local patient support programs today. Nicole, thanks so much for being here.
Thanks so much for having me back.
You
Glad
bet.
To be here.
A little bit of a rainy ride in,
a little bit, but the sun's coming out now.
All right, great. All right, let's just start out talking about patient support impact, as you have in your notes here, for Fulton County and the surrounding region. What does that look like, Nicole?
Yeah, great. Thanks again. Really appreciate having me come back. We had a chance last time to really kind of give a bigger overview of some of the patient support and what ACS does in our patient support pillar. But today, I really would love to talk about a couple of programs that are local and that impact your audience members right here in Fulton County. The first is a Road to Recovery, which I mentioned it last time. It's our free volunteer driven driver program. It engages volunteer drivers to provide free rides to cancer treatment. So we know that barrier to care for transportation to get to and from cancer-related appointments is a real struggle for a lot of folks, especially if you have to drive a little bit farther to get to your appointments. Right,
it's a pretty big deal, and you guys are filling the gap.
We are, absolutely. So we want to do everything that we can to minimize or even eliminate that barrier to care. So Road to Recovery, what it is that you can call, you can have your navigators at your hospitals, your clinical team help you figure out how to enter any upcoming appointments that you have. And then we have a team of trained volunteers who sign up. So it's sort of, we match volunteers to where patients need the help. So,
and this has been going on for the last couple of years, Nicole,
Gosh,
right?
It's been going on for a while. We did have to take a little bit of a break during COVID, obviously, but we relaunched the program in November of 2021. And since then, just in the state of Illinois, 128 volunteers have provided over 1,800 rides to patients. Just since January of this year, 975 rides have been provided to 105 patients. So we're really ramping back up again.
Right, and we're talking about also active drivers in surrounding counties like Knox, McLean, Mercer, Peoria, Tazewell, Woodford, Putnam, and Rock Island.
Absolutely. So we're in the area. We have active drivers, but we always need more. And the biggest thing today that I would love to share is recruitment, how you can become a volunteer. What you do is you just go to cancer.org and you can search for Road to Recovery. Click on Volunteer to Drive Cancer Patients button, and it will give you all the information that you need about how you can sign up to be a volunteer driver.
If you just joined us, we're talking to Nicole Robertson of the American Cancer Society, and we're talking about all the patient support that's available to people either with or impacted by cancer. And before we go on to some music and the next talk break, I want to get it in here, Nicole, the transportation and lodging grants. What's that all about? It seems like a real valuable resource for us.
Yeah, it really is. So this is an opportunity that we partner directly with cancer centers all over the country and here in the state of Illinois. So hospitals, health systems that provide that cancer treatment and support. And what we do, again, talking about those barriers to care for transportation and lodging, we work directly with our hospital partners to provide them grant funding so that they can provide transportation, whether that's gas cards or Uber or Lyft coverage, bus passes, whatever the most appropriate thing is to support their patients. So we can talk a little bit more about what that looks like, but that's a really significant investment that we've made in the state of Illinois and across the country to reduce those barriers to care.
And a reminder to our listeners, Nicole, if you're in active treatment, you can ask your oncology team if their hospital has an active grant with ACS. How does someone go about doing that? Who would they approach?
Yeah, you can talk to your navigators. At the hospital, you'll hear a lot about patient navigators. You can talk to your nurses. You can ask your social workers. They should know. And what you would want to just say is, hey, I wonder, does American Cancer Society, are there any transportation or lodging funds available to help me get to and from my appointments? And you can mention American Cancer Society, you can mention transportation or lodging grants to any of those folks, And if they don't know, they can work with their team to find out.
And those are actually awarded to hospital partners all across Illinois, and it's a 50-50 split. Is that right, Nicole, between Chicago metro area and the rest, kind of central downstate Illinois?
Yeah, that's where we are approximately for 2023. So for the grants that were awarded to hospital systems and partners across the state, we really, we want to make sure that we're intentional in reaching out to people. And this is a program that is a really, really valuable resource in more rural communities who quite often they have to travel longer distances for their appointments. So we want to make sure that we're being really mindful of the fact that transportation is a big barrier often. So we do have grants awarded to hospital partners all across the state in the Chicago metro area, but then central and downstate Illinois.
Awesome. And you have 11 transportation grants. Says here $135,000 in investment and 3 lodging grants awarded for a total of $40,000.
That's right. And that's just this year. That varies. We offer grants every single year. There's a whole application process that we work with our cancer center partners. But yeah, we have 11 active transportation grants that vary in dollar amount depending on patient need. But it's a pretty significant investment just here in the state of Illinois. And we are committed to continuing that investment.
Nicole Robertson is here with the American Cancer Society, and we're going to play a little bit of Luke Combs and Fast Car. When we come back, we're going to talk about their Reach to Recovery program and the Cancer Survivors Network. All that's coming up. It's Fast Car on 94.1 BYS. Luke Combs, Fast Car. I know a lot of you are hoping that Tracy Chapman and Luke Combs do that song together. I am, and you heard it here in your country favorites from today and yesterday. And if you just joined us, we're talking with Nicole Robertson of the American Cancer Society. We're talking about all of their cool local patient support programs that you should know about if you are dealing with cancer, are you affected by cancer, if you have cancer or a family member or a friend, this interview is for you. Nicole, let's talk a little bit about the Reach to Recovery program. What's that all about?
Sure. The Reach to Recovery program is an online resource that is available at reach.cancer.org. And what it does is it connects people facing breast cancer, specifically from diagnosis to survivorship. So we really want to make sure, again, that we are helping people along that entire continuum of care.
And there's an effort there to be matched with a volunteer.
Yeah, that's really the crux of this. What we do is we match you with trained volunteers who are breast cancer survivors who really share that same lived experience. And it's a really valuable resource. There's criteria that you enter when you go online to put your name in, and then we'll match you with an appropriate volunteer.
Very cool. And also for folks who don't know, you have a Cancer Survivors Network.
Yep. Again, it's an online resource. But what Cancer Survivors Network does is it provides safe online connections for cancer patients and their caregivers, which is a really important piece as well. We know how impactful and how challenging and what it means to be the patient to receive a cancer diagnosis, but it's really primary caregivers and caregivers really need that support as well. So both patients and caregivers can join discussion boards, chat rooms, build your own network, just to connect with other people that are, again, going through the same thing and have that same lived experience. And the Cancer Survivors Network is not cancer specific, as opposed to Reach to Recovery, which is specifically focused on breast cancer. The Cancer Survivors Network is available to anyone with any cancer diagnosis.
Nicole Robertson is here. She's with the American Cancer Society. We're talking about all the great things they do in the name of patient support. And before we break again, why don't we talk a little bit about tender loving care, and then we'll cover the rest on the next break. How does that sound, Nicole?
That sounds great. Yeah. So Tender Loving Care, or TLC, is a publication. It's a catalog, really, of products for women to help them cope with appearance-related side effects of cancer treatment. And what we mean by that are wigs or hair pieces, headwear, mastectomy products, all of those types of things that would be relevant for women who are going through breast cancer.
And not everybody thinks about those types of things, this kind of the ancillary responsibilities folks have to make themselves feel as good as possible.
Absolutely. Absolutely. There's a lot of ways that we can really approach and support. That's really what we do in the patient support pillar, is think of all of the various ways and the support that patients need need as they're going through cancer treatment and into survivorship. You can access the TLC catalog by just tlcdirect.org, or you can call 800-850-9445. But all of these resources, again, are available at cancer.org. You can go and just even search for it if you go to cancer.org.
What do you say to our listener who's feeling overwhelmed, whether they're dealing with cancer themselves or a family member, and they feel they may not have the bandwidth to reach out? A reminder to our listeners, when you reach out, you're making life easier for you and your loved ones, right?
Yeah, it really is. The connection, make a connection. That human connection is so important, and really that's what we really want to do, is provide that opportunity for patients and caregivers to connect with other people who, even if it's just to say, this is really hard and I don't know where to go. You're not alone in this journey. You're not alone in this cancer, the fight against cancer. We are here to support patients and caregivers. So please reach out, connect with us, call the 800 number, go to our website, and we will be able to, we want to make sure that you have the resources, education, everything that you need to go through this journey.
Nicole Robertson's here. She's with the American Cancer Society. Stick around. We're going to talk in the next talk break about Hope Lodges and give some more free resources available, 24/7 resources. All right. I'm going to be playing a little bit of Eric Church here, Heart on Fire. This is for Annie and the girls at the beauty shop right here in Canton. Heart on Fire. On a Thursday, one day before Friday on 94.1 BYS.
Cancer-related, treatment-related research, but we do research around population health and equity health science. So we really want to, again, make the investment around research across the entire continuum. But from a patient support standpoint, this is what we've been talking about this morning, the amount of resources and programs that we work very closely with community groups. We work with clinics or federally qualified healthcare clinics.
Right.
We work with hospital partners, and we provide that patient support directly to patients.
And let's talk a little bit about Hope Lodges. And folks, if you just joined us, we're talking with Nicole Robertson of the American Cancer Society. There are 30 locations of Hope Lodges across the country. What are these, Nicole, and what do they provide?
Yeah, Hope Lodges. So we've talked a lot this morning about those barriers to care, and the two biggest ones are transportation and lodging. So our Hope Lodges address the lodging barrier to care. And what this is if you have to travel or stay outside of your home area, outside of your home city, what the Hope Lodges do, we have 30 plus locations across the country that provide a free place to stay during treatment.
That's amazing.
And on average, we provide about 500,000 nights of free lodging per year, which means that we are able to help 29,000 patients and caregivers every year. Really, again, not have to worry about if I have to go and I have to stay for a few nights or a week, or it could be longer.
Right.
How am I going to do that? I can't afford a hotel. I don't have anywhere to stay. That's what our Hope Lodges do, is we really take away that barrier to care and let people know that they have a safe, comfortable, welcoming environment that they can stay in when they're outside of their home.
Nicole Robertson's here. We've been talking all things American Cancer Society in terms of what they do for patient support. Let's talk about the resources that are available for folks if they have any questions. A 24-hour, 7-day-a-week hotline and a couple other nice things, including an app and a live chat room that we can talk about. Nicole, there's a lot of resources available.
There are, and we really want to give people a lot of options. Some people like to connect via connect online. Some people like to call an 800 number. So we really want to make sure that we are offering a variety of ways that you can connect with us. Our biggest one, obviously, and maybe the one that people might know the most about, is our National Cancer Information Center, which is our 800 number. That number is 800-227-2345. That is a free resource that is available 24/7. We have trained staff that are available to answer really any and all of your questions. If you call and just say, I don't even know where to start. This is what I'm looking for. Can ACS help? That's what they're trained to do, is really kind of connect you and direct you to the resources that you need.
1-800-227-2345 is that number for free resource. It's a 24-hour, 7-day-a-week number if you need to just call. And also, there's a digital app you have, and let's talk about that live chat, because some folks are just looking for someone to talk to.
Yeah, this is really exciting. So again, on cancer.org, you can go there. You can connect via live chat. So if you prefer online communication, that's a great resource. You can connect directly with someone and have that opportunity to chat in real time with someone on the cancer.org website. The app that you talked about, we're really excited about this. It's called ACS Cares. And it's another way to connect with patients and caregivers with the education, with the resources that they need. You can find it if you go to cancer.org. And again, look up ACS Cares. There's a link to it. It's a downloadable digital app. And what's really cool about this is that it allows you to personalize your connection. So it changes and adapts as information changes, or as as time goes by. You can customize it and personalize it to the resources and education that you need as a patient or a caregiver.
Nicole, thank you for being here today. And before I let you go, I know you wanted to mention something that our listeners should kind of back pocket. It's a little bit down the road, but October 20th, you have a cancer screening day. Why don't we, and again, I know we're going to have you on next month, but let's just talk a little bit about this.
Absolutely. So this is an event, this is really in partnership with our hospital partners. So I work with hospitals all over the central Illinois area, and on October 20th, this will not necessarily, it's not an American Cancer Society event, but we partner so closely with our hospital system. So Carle Health, OSF Healthcare will be having a cancer screening day on October 20th from 8 to 2, where a variety of cancer screenings, lung cancer screening, skin cancer, colon cancer, cervical cancer, breast cancer, all of that information will be available. This is a community-wide screening day, so we'll have more information for that coming up, but just know that our hospital partners are fantastic partners to really make sure that people have access to the screening resources that they need. So more information to come, but mark that on your calendar, and that'll happen in the Peoria area. Nicole Robertson, thanks so much for being here. I'll see you next month, okay? Great. Thanks so much for having me. You bet. Love having you. 1-800-227-2345 is a 24-hour, 7-day-a-week number to call if you have any questions about cancer, whether you're dealing with cancer or a family member, a friend, or loved one is. Lots of resources. All right, Kelsia Ballerini, if you go down, I'm going down too, here on 94.1 BYS.